Hello, my name is Joan Smyth, originally from Northern Ireland. I am a graduate of University College Dublin and I later did a PhD in Queen's University Belfast, Northern Ireland. I became a diplomat of the European College of Veterinary Pathologists in 1997. Earlier this year, I became a Fellow of the Royal College of Veterinary Surgeons for meritorious contributions to knowledge, and I feel very honoured about that. I feel doubly honoured to have been invited to be a featured fellow this year. So today, in the next few minutes, I'm going to give a quick snapshot of some of the discoveries of novel diseases and concepts that I have made during my career in diagnostic veterinary pathology. So I'm going to talk about some of my personal discoveries of novel diseases. I'm going to use two examples, bovine adenoviral enterocolitis and circoviral diseases. Then I'll make brief mention of some diseases that I discovered that were new to the region that I worked in at the time. And then I will finish up with some work that I did that has led to major rethinks in the pathogenesis of some what were considered established mechanisms. So the first example of a novel disease discovery that I'm going to use is fatal bovine adenoviral enterocolitis. And the index case I had was in 1984 when an 8-month-old bullock was presented for post-mortem examination after a sudden onset bloody diarrhea, a subnormal temperature and death within a couple of hours of first presentation. At post-mortem examination, this case was dramatic with a severe necrohemorrhagic enteritis and colitis. This picture shows the colon from this bullock. It's very hemorrhagic and you can see there are scattered over the surface these fibrinous exudates, clumps of fibrinous exudate. And when I did histology on this case, I was very surprised to discover enlarged endothelial nuclei in the blood vessels of the intestine. These nuclei were enlarged because of the presence of amphiphilic to basophilic inclusion bodies that distend the nucleus and marginate the chromatin. I didn't know what this disease was, but I had some suspicions as to what was causing these inclusions. So I had to do ultrastructural examination and I was able to identify adenovirus particles within the inclusions. These particles were confirmed as adenovirus subsequently by immunohistochemistry for using an adenovirus antibody. In the next 2 to 3 years, I discovered 12 more cases of this disease in Northern Ireland. Several of these actually identified by the same practitioner who had submitted the first case. He considered that the case had a very characteristic clinical presentation. As it turned out, all 13 of the cases I had were all caused by bovine adenovirus serotype 10. Now serotype 10 had only been reported once before, maybe about 20 years earlier in New Zealand. And these cases that I had were the first confirmed association of bovine adenovirus type 10 with disease. Of the 13 cases in Northern Ireland, the affected age range was 5 months to 2-year-old, and all had sudden onset disease and a short clinical course. So in studying the literature and watching out for other cases of this disease elsewhere, I did find I was able to contact the authors of from cases in Canada, England, Italy and the Netherlands, and I was able to gather 17 cases from these people, and of these 10 turned out to be, were confirmed to be bovine adenovirus type 10, and 6 were shown to be subgroup 2 bovine adenovirus. In one case we were unable to identify the type of adenovirus involved. So collectively, all of these cases where adenovirus was found in enterocolitis, the age range affected was from 6 days old to 2 years, and all had this characteristic short clinical course and hemorrhagic diarrhea. However, the incidence of non-fatal cases of this disease remains unknown to this day. Most of the cases found throughout the world to date have been associated with bovine adenovirus type 10, but some others are associated with bovine adenovirus type 4 and other subgroup 2 bovine adenoviruses. And at this time, cases continue to occur sporadically throughout the world. So the second novel disease that I have worked on, personal discoveries, have been circoviral diseases, and the index case that I found here was in 1993 in racing pigeons. A 3-month-old racing pigeon presented for post-mortem examination with a history of diarrhea and some ill thrift. This is an image of the spleen showing these large eosinophilic to amphiphilic structures in the spleen, and being honest, at the time I had no idea what these structures were or what was causing them. This is the bursa fabricius from a 9-week-old pigeon from the same racing pigeon loft, and here we can see many more of these more basophilic in this particular image structures within the medulla and also in the cortex of the follicles of the bursa fabricius. Again, wasn't sure what was causing these structures, so again went to the transmission electron microscope and discovered that these structures were made up of paracrystalline arrays of very small virus particles. These virus particles measured about 17 to 19 nanometers, which puts them among the smallest known virus particles. And at the time, the smallest known viruses were the circoviruses, of which 2 circoviruses were known. Porcine circovirus, at that time only one porcine circovirus type was recognised, later became porcine circovirus 1. Of course, we now know that there's porcine circovirus 2 and 3. And again, at the time, cytosine beak and feather disease virus was the second known circovirus. These viruses are very interesting, not only because they're the smallest known viruses, but also because they have single-stranded DNA. And single-stranded DNA, as you know, is pretty uncommon in nature. So together with Danny Todd, a molecular biologist, a molecular virologist I should say, we went on to develop diagnostic tests to enable further study of these circovirus infections in pigeons in the first instance. So this image shows in situ hybridization for pigeon circovirus by probes we developed ourselves, and we can see lots of DNA in the bursa fabricius, both in the medulla and the cortex of the follicles. So we did a lot of studies in pigeons and developed a lot of information that enhanced the understanding of this disease in pigeons, and I'll summarise that later. But using this in situ hybridization technique, I find that if I varied the stringency conditions, that the same probe could be used to detect circoviruses and other avian species as well. And using this approach, a combined pathology and in situ hybridization, I should say histopathological examination combined with in situ hybridization, I was then able to identify and confirm the presence of circovirus infections in commercial geese flocks, in commercial ducks, in southern blackback gull, that was from Australia, a Guldian finch from California, herring gulls and black-headed gulls. Working together with my molecular virologist colleague Danny Todd, we were able to show that these circoviruses actually were all individual species. So there's quite a number of circoviruses that infect avian species. The current count is at about 39 in the years since we first discovered pigeon circovirus, and these are quite species specific. So there's a goose circovirus, there's a duck circovirus, there's a gull circovirus, finch circovirus, and so on. These images show the beautiful, more eosinophilic inclusions here in the bursa fabricius of a gull, and this is in situ hybridization of the bursa fabricius of a goose, showing abundant goose circovirus DNA present. So we went on, as I said, to study these diseases mainly in pigeons, geese and ducks, and discovered that it's now known that circoviruses are occurring worldwide. They're very common in some species of birds. As I've already mentioned, the circovirus species are species specific, animal species specific, and it's very likely that many more species are still to be discovered. These circoviruses like to target lymphoid tissues and they cause marked immunosuppression. At this time, other primary syndromes are being discovered. So for example, there's been fibrosing cholangitis has been identified in ducks, and if pigs are anything to go by, many more primary syndromes will yet be discovered. It's important to realise that secondary infections are very common in these infected birds due to the immunosuppression, and indeed the secondary infection may be the reason for the presentation to the veterinarian or to the pathologist, and it's important to be aware that there may be an underlying circoviral infection. We were also able to show in ducks and in pigeons that vertical and horizontal transmission occurs. And even though these viruses have been known now for a long time, there's no vaccine developed as yet, and prevention remains problematic. At this time, it's basically not known whether it's best to try to eliminate the infection or simply try to live with it. Roll on then to 2017, by which time I was now working in the United States in Connecticut, and we had a dog presented for post-mortem examination which presented with these changes in the intestine, a very mottled small and portion of the large intestine. These actually represent infarcts, these hemorrhagic regions, and the content of the large intestine here was hemorrhagic as well. So this was diagnosed as a hemorrhagic gastroenteritis, and histologically there was marked necrosis of crypt epithelium, fibrinoid necrosis of blood vessels throughout the body, and this is a blood vessel in the brain where there's necrosis of endothelium and a little bit of a lymphocytic, histiocytic reaction. This particular dog that we had seen was 5 months old, a rescue dog that had actually been in its short life in 3 different states in America. It had presented with lethargy, inappetence and bleeding gums. There had been a case reported earlier in the United States which we recognised the similarities in these cases, and we were able to confirm our case in 2017 as canine circoviral disease by using PCR combined with sequencing and ruling out other known causes of canine gastroenteritis such as parvovirus, canine distemper, etc. So the very first cases of circoviral disease in dogs were in 2013 in California, severe hemorrhagic gastroenteritis in 4 dogs. Then in 2014, hemorrhagic enteritis in a dog in Italy was identified, and then cases in Germany and Thailand in 2017. At this time, canine circovirus infection is now recognised in many countries in dogs and also more recently in foxes. Commonly presents as gastroenteritis and often as a co-infection with canine parvovirus. An important note that I would like people to be aware of, that when we discovered these diseases, it was done with a lot of slog. Nowadays there's been considerable advances in DNA sequencing and metagenomic approaches, and this has resulted in an explosion of discovery of circoviruses in many species. But I want to emphasise that the significance of these circoviruses can only be determined in conjunction with careful clinical and pathological examination by veterinarians. Over the course of my career, I have discovered many diseases that are well known but were new to the area I was working in. For example, thyroid hyperplasia in cattle and sheep in Northern Ireland. In the interest of time, I won't mention any more. And I'm now going to move on to my third topic, some discoveries that I made that has led to a major rethink in the pathogenesis of disease. So the first example I'm going to use is considering how viruses are transmitted horizontally between birds. And the example in this case is egg drop syndrome virus, which was discovered in 1976, caused by an adenovirus. Now this disease, when it first appeared, spread very rapidly throughout the broiler breeder sector, and then later appeared in commercial egg layers where it spread rapidly as well. And it was known that it spread by both vertical and horizontal routes. The dogma at the time was that horizontal transmission was through the fecal-oral route, that it was fecal transmission, fecal contamination that was responsible for lateral spread of this disease. However, I became involved in looking at the pathology and pathogenesis of this virus infection, and during my examinations of the small intestine, I could find very little evidence of the virus replicating in the intestine. It did not replicate in the epithelium. If it was there at all, it was present in the lymphoid tissue. This was not consistent with a fecally transmitted virus. When I looked at the oviduct, and this is immunohistochemistry here for staining the viral antigen, we found lots of virus present in the epithelium of the shell gland. And in fact, this is very consistent with the production of the abnormal eggs which characterize this disease. Now, with all this virus present in the epithelium, I speculated that it was the secretions from the oviduct that were responsible for the spread of this virus from bird to bird. And I hypothesized that virus would be present on and in these affected eggs. And indeed, I designed some experiments and went on to prove that this virus was in fact transmitted by the egg. You may or may not be aware that hens will very readily ingest and avidly ingest these abnormal eggs. They will eat them, and they will also contaminate the keys trays. And it's now recognised since that time that actually the egg is a very important source of transmission of virus between flocks rather than feces. Things like avian influenza, for example. The second one that I will discuss is the importance of adhesion in Clostridial disease. The disease that I'm going to use here is necrotic enteritis in poultry, which was first discovered in 1955. The dogma since that time was that this disease occurred when conditions in the gut allowed the causal organism, to multiply and produce its toxin in the intestine. However, when I was studying this disease pathologically, I could see cases where there were thousands of organisms here in the intestine, but the epithelium looked quite healthy. And this didn't really fit with the theory, and in fact we were actually able to demonstrate alpha toxin present in this particular intestine, but yet this epithelium is quite healthy. In studying cases of the disease, noticed that there was necrosis of the surface epithelium in this particular case, but all this blue that you see here are masses of bacteria which are stuck onto the surface of this dead tissue. Now, it's hard to know whether they're stuck there, whether they're taking advantage of the dead tissue, or whether they became adherent and caused the tissue to die. This is a higher magnification, an image that I took in 2003, which shows these adherent organisms. So I came up with a hypothesis that adhesion was part of the pathogenetic mechanism. Now, I can tell you that when I applied for funding to USDA to research this and try to prove this hypothesis was basically ridiculed. But luckily I was able to get money from another source and was able to confirm that the ability of Clostridium perfringens to produce disease was directly linked to their ability to adhere to extracellular matrix molecules and epithelial cells. And indeed, in 2016, this was confirmed conclusively by a nice set of experiments done by an Australian group, where they knocked out a gene for adhesion to collagen and in so doing they eliminated the ability of Clostridium perfringens to produce disease. So pathology had turned the dogma thinking on its head. And finally, what I would just like to say is that I got my fellowship for meritorious contributions to knowledge. I hope you have enjoyed this small snapshot of some of the contributions I have made over the years, and that perhaps maybe you might even have learned something new in this short talk. Thank you for listening.